Assalamualaikum and good day to our lecturer and friend. Today, we will present our assignment for the course IHS 122 Industrial Hygiene Law Standard and Guidelines. Our topic is Occupational Health Guideline and Environmental Quality Act 1974 with a focus on industrial hygiene and workplace health. Industrial hygiene focuses on protecting workers from health hazards in the workplace. In Malaysia, beside the Occupational Safety and Health Act 1994, there are several occupational health guidelines and related laws that help improve workplace safety and health. These guidelines and laws aim to control different types of hazards such as biological, psychosocial, chemical and environmental hazards. This presentation discusses key occupational health guidelines in Malaysia, including Aedes mosquito control at construction site, prevention of stress and violence at the workplace, prevention of drug, alcohol, and substance abuse, as well as the Environmental Quality Act 1974 to show how they support industrial hygiene practice and help create a safe and healthy working environment. Okay, we move to the next one is why occupational health guidelines are important. The first one is protect worker physical and mental health. The second one is reduce workplace disease and accidents. And the third one is improve productivity and safety culture. And the last one is support compliance with occupational safety and health law in Malaysia.
The first guideline is the Guideline on Aedes mosquito control at construction site issued in 2015. This guideline was introduced to control biological hazards caused by Aedes mosquito. Aedes mosquitoes can spread dangerous diseases such as dengue, Zika, and chikungunya. Construction sites are considered high-risk areas because stagnant water can easily collect and become mosquito breeding grounds. The objective of this guideline are to prevent mosquito breeding at construction site. It also aims to reduce the risk of dengue outbreaks among workers and the public. In addition, the guideline promotes good environmental hygiene and proper site management. Some key control measures include eliminating stagnant water at construction site. Proper drainage and waste management should be practiced to prevent water accumulation. Regular inspection of water containers is required to detect mosquito breeding early. Fogging, herbiciding may be carried out when necessary. Lastly, responsible personnel should be appointed to manage mosquito control activities. This guideline is important to industrial hygiene because it helps control biological hazards in the workplace. It prevents occupational-related infectious disease among workers. It also protects the health of nearby communities and supports a safe and healthy working environment.
Assalamualaikum. My name is Muhammad bin Azli. Today I'm going to talk about stress, violence at the workplace. For this slide, for the overview, the second guidelines is the guidelines for the prevention of stress and violence at the workplace, introduced in 2001. This guideline focuses on physiosocial hazard at work. It addresses issues such as work-related stress, workplace bullying, harassment, and physical or verbal violence. Next, causes of stress and violence. There are several causes of stress and violence at the workplace. These include excessive workload and long working hours. Poor management and communication can also increase stress among workers. Others causes include job insecurity and conflict between workers. And next, prevention strategy. To prevent stress and violence, a good work organization and proper job design should be implemented. Clear workplace policies and procedures are important to guide worker behavior. Training and awareness program help workers understand how to manage stress and prevent violence. Effective communication between management and workers is also necessary. Lastly, reporting and support systems should be provided for affected workers. And next, importance to industrial hygiene. These guidelines protect workers' mental and emotional health. It helps reduce absenteeism and low productivity caused by stress. It also promotes a positive and safe working environment and improve overall workplace well-being. Next, in the guidelines 3, we have a good work organization and job design, code of practice for prevention and eradication of drug, alcohol, and substance abuse at the workplace 2005, and clear workplace policy and procedure, training and awareness program, effective communication between management and workers, and lastly, reporting and support system for affected workers.
Hello and hi. Okay, this is me, Izwan. Okay, I will explain about this slide. Effect of drug and alcohol above a workplace. So the first, we have an increased risk of accident injury. What is this? The drug and alcohol use can impair coordination, reaction time, and concentration. Workers under the influence are more likely to make mistakes, leading to workplace accident and serious injury. So the second was reduce work performance and productivity. Substance above affect concentration, motivation, and energy level. This result is poor work performance, increased error, and lower overall productivity in the workplace. So the last but not least, poor judgment and unsafe behavior. Alcohol and drug reduce the ability to make good decision. Worker make no safe producer, take any risk or fail to follow workplace rule. So the last has a negative impact on core worker and workplace safety. Substance above can describe teamwork and create unsafe condition for other workers. It can cause conflict, low morale, and increase safety risk for everyone in the workplace. Okay, this is me again. So in this slide, I will explain about the key measure in code of practice. Okay, for the first, employer should conduct education and awareness program to inform worker about the danger and health effect of drug and alcohol above. So next, the workplace should develop and implement a clear policy on drug, alcohol, and substance abuse to guide employer behavior and responsibility. Next, employer assistance program and rehabilitation support should be provided to help affected worker recovery and return to work safety. So the last but not least, we have fair and consistent disciplinary action should be taken when necessary to ensure workplace safety and compliance with company policy. So the last, we have a confidentiality must be maintained and worker right should be respected throughout the prevention, management, and rehabilitation process. So let's go for the next slide. Let's go to the important to industry hygiene, drug and alcohol control. So the first, we have maintain a safe and productive workplace. Okay, the second, support worker health and recovery. The third, trigger safety culture and workplace. For the last but not least, but this is last for the important is prevent unsafe act and accident. Okay, still with me. For this slide is about Environmental Quality Act 1974. The first, the environmental Quality Act 1974 is enforced by the Department of Environment (DOE). Second, the Act aims to prevent, reduce and control environmental pollution. The third, it covers pollution related to air, water, noise, soil and schedule was. Last is environmental pollution can direct affect worker health and workplace safety. Okay, so in this slide, the importance of EQA 1974 to industrial hygiene. So for the first, we have in control environmental source of chemical and physical hazard. So the next, the second, prevent worker exposure to air pollution, toxic waste and excess noise. So the third, we support industrial hygiene by controlling hazard at the source. So the last, we have protect both worker and surrounding community. Next is like overall impact on industrial hygiene. So overall, this occupational health guideline and the Environmental Quality Act 1974 complement the Occupational Safety and Health Act 1994. They address biological, physical, social, chemical and environmental hazard. They help employer implement effective industrial hygiene practice. So together, they promote holistic occupational health protection. So this is last for our presentation. So this is the conclusion. Occupational health guidelines are essential in industrial hygiene as they provide systematic control of biological, physical, social and chemical hazard in the workplace. Effective implementation it reduce occupational disease, workplace accident and health risk. Strong cooperation between employer and worker ensure a safe, healthy and productive working environment. So thank you for watching our presentation. Bye.